hard. They cut bread and sweets, they walk more, but still struggle with high blood sugar. I truly care about you, and today I want to tell you about one of the most discussed scientific topics of recent years, the molecule NAD+ and its precursors, nicotinamide mononucleotide and nicotinamide riboside. There is a lot of noise around this subject. Some promise a revolution in diabetes treatment, others say it is just marketing. Today, we will figure it out, what NAD+ is, how it is connected with insulin resistance, what real scientific studies show, and whether it makes sense to use these supplements. According to the World Health Organization, more than 420 million people worldwide live with diabetes, and this number continues to grow. In the search for new solutions, science is increasingly focusing on cellular metabolism. NAD+ is a coenzyme without which cells cannot produce energy. Its level declines with age, obesity, and type 2 diabetes. Scientists asked a simple question: if we increase NAD+, can we improve insulin sensitivity and lower blood sugar? What NAD+ is in simple words. Imagine that the cell has an engine, the mitochondria. For this engine to work, it needs both a battery and a key. NAD+ is both the battery and the key. It participates in turning glucose and fats into energy, regulates enzymes responsible for insulin sensitivity, supports recovery processes inside the cell. When there is little NAD+, the engine misfires, muscles take up less glucose, the liver resists insulin more strongly, and blood sugar rises. Research data, Scientific Dramaturgy First Study, Nicotinamide Mononucleotide Science, 2021, randomized controlled trial, 25 women with prediabetes, 10 weeks, 250 milligrams per day of nicotinamide mononucleotide. Results: improved glucose uptake by muscles measured by clamp technique, but hemoglobin A1C and blood sugar did not change. Conclusion: nicotinamide mononucleotide can improve muscle insulin signaling, but the effect on blood sugar itself is almost absent. Second study, nicotinamide riboside cell metabolism, 2018, randomized controlled trial, 40 men with obesity, 12 weeks, 1,000 milligrams per day of nicotinamide riboside. Results: blood NAD+ levels increased, but insulin sensitivity and blood glucose levels hardly changed. Conclusion: nicotinamide riboside raises NAD+, but without diet and physical activity, the benefits are minimal. Reviews and meta-analyses, Endocrine Reviews 2020, decrease of NAD+ is linked to obesity, diabetes, and aging. Theoretically, increasing NAD+ may help, but clinical data are insufficient. Mayo Clinic 2022 and Harvard Health 2021, nicotinamide mononucleotide and nicotinamide riboside are considered safe in short-term use, but there are no long-term safety data. Should this be used in practice? Let us be honest. Intravenous infusion of NAD+ is pointless. There is no evidence that it lowers blood sugar. This is more marketing than medicine. Oral nicotinamide mononucleotide or nicotinamide riboside are possible as experiments or additional measures, but do not expect miracles. Hemoglobin A1C and fasting glucose do not decrease as they do with metformin or diet. The main effect of NAD+ is at the cellular and molecular level, but in real clinical life, the effect is minimal. What actually works? Blood sugar reduction and even remission have been proven in tens of thousands of patients with diet, carbohydrate budget of 15 to 30 grams per meal, physical activity, 150-300 minutes of walking per week, plus strength training 2 times per week. Weight loss, at least 5 to 7%. Correction of deficiencies, vitamin D, magnesium, omega-3 fatty acids, iron, testosterone when indicated. Standard medications, metformin, GLP-1 receptor agonists, SGLT2 inhibitors. Final conclusion: NAD+ is an interesting and important molecule. It is truly connected with cellular energy and insulin resistance. Supplements with nicotinamide mononucleotide and nicotinamide riboside raise NAD+ levels in the blood, but as of today, they have not proven a significant effect on hemoglobin A1C or blood sugar in patients with type 2 diabetes. Practical meaning, not the foundation of therapy, only an optional experiment for enthusiasts or within research projects. Friends, please remember, there is no magic pill. But if you eat properly, move daily, correct deficiencies, and take medications when needed, your blood sugar can be stable and type 2 diabetes can be controlled. And now my question to you, would you like me to make a separate video about which supplements really help in diabetes and which ones are only marketing? Friends, let me begin with care for you. Every day I meet patients who try very hard and they change their diet, they reduce bread and sweets, they walk after meals, But unfortunately, many still struggle with high blood sugar, and this leads to disappointment and fatigue. That is why it is so important to know about safe, scientifically proven supplements that can really help. Today, we will talk about psyllium, a soluble fiber from the husks of Plantago ovata seeds, which has documented blood sugar lowering effects. Why this is important? According to the World Health Organization 2022, more than 422 million people worldwide live with type 2 diabetes. The American Diabetes Association, ADA 2022, emphasizes that increasing dietary fiber intake, especially soluble fiber, is one of the key strategies for blood sugar control. The problem is that most people consume only 10-15 grams of fiber daily, while the recommended amount is 25-30 grams. Psyllium is a concentrated source of soluble fiber and has been repeatedly shown to lower blood sugar. How psyllium works? The mechanism. Psyllium forms a viscous gel in the intestine, slowing down digestion and absorption of glucose. This results in lower post-meal blood sugar spikes, reduced stress on the pancreas, and longer satiety. Diabetes Care 2020. A randomized controlled trial with 204 patients with type 2 diabetes. They were given 5 grams of psyllium twice daily, total 10 a day, for 8 weeks. Results: fasting glucose decreased by 0.8 mmol, HbA1c decreased by 0.4%, insulin sensitivity improved significantly. Evidence-based The Lancet 2019 meta-analysis included 35 randomized controlled trials with more than 2,100 participants. Doses range from 10-15 grams day, duration 4 to 12 weeks. Results: fasting glucose 0.6-1.1 mmol, HbA1c 0.3-0.5%. Stronger effects in patients with baseline HbA1c above 7%. BMJ 2021 systematic review analyzed 17 trials with 12 and 50 patients with type 2 diabetes and metabolic syndrome. Doses 7-12 grams day, divided into 2 to 3 servings, duration 12 weeks. Results: fasting glucose 1.0 HbA1c 0.36%, fasting insulin 9-12%. Mayo Clinic Proceedings 2020, 300 patients with obesity and type 2 diabetes. Dose: 5 grams psyllium twice daily for 12 weeks. Results: fasting glucose 0.9 ml, HbA1c 0.42%, average body weight reduction 2.5 kilo. Cleveland Clinic Journal of Medicine 2021, 180 patients received 10 grams or day in 2 doses for 6 weeks. Results: fasting glucose 0.7 mol, HbA1c 0.3%, postprandial glucose decreased by 1.5 to 2 mol. Practical recommendations for dosage: starting dose 5 grams once daily to allow the gut to adapt. Therapeutic dose 10 grams day, 5 grams twice daily. Optimal dose 12-15 grams day, divided into 2 to 3 servings. Duration minimum 8 to 12 weeks, some studies extended up to 6 months. Important condition: must be taken with enough water, at least 1.52 liters of fluids daily. Safety side effects are rare: mild bloating in the beginning, which resolves as the dose is increased gradually. Harvard Health 2020 emphasizes that psyllium is safe for long-term use if proper hydration is maintained. Fourth layer: correcting deficiencies. For maximum effects, psyllium should be part of a comprehensive plan that includes addressing nutrient and hormone deficiencies. Vitamin D, Diabetes Care 2021, 2,500 participants. Reduced risk of progression from prediabetes to diabetes by 30%. Magnesium, Diabetes Care 2017, 1,500 participants. Lowered fasting glucose by 0.3 mmol. Omega-3 fatty acids, nutrients 2020. Reduced inflammation and liver fat. Testosterone, Endocrine Reviews 2019. Correcting low testosterone improved insulin sensitivity. Iron. Both deficiency and overload worsened glucose metabolism. Maintaining optimal ferritin is essential. Conclusion. Friends, now you know. Psyllium is not just fiber, but a scientifically proven tool against type 2 diabetes. It lowers fasting glucose by 0.6-1.1 mol, reduces HbA1c by 0.3-0.5%, improves insulin sensitivity, and helps with weight management. If you add 10-15 grams chaque day of psyllium, divided into 2 to 3 doses for at least 8 to 12 weeks while drinking enough water, your blood sugar will become more stable and your risk of complications will decrease. I guarantee with the right approach, diet, physical activity, correction of deficiencies, and adding psyllium, type 2 diabetes can be controlled, and in prediabetes, remission is achievable. Now my question for you, have you ever tried psyllium and how do you prefer to use it? In water, in yogurt, or added to meals? Dear friends, let me start with honesty. Every day, I see patients who truly believe in the myth of so-called healthy fruits for diabetes. They are told by doctors, bloggers, and articles online to eat apples, pears, citrus fruits, berries, even bananas as a source of vitamins. And then these same patients come back with high blood sugar, blurred vision, or even kidney damage. I genuinely care about you, and that is why I made this video. Today I will reveal the truth. There are only two fruits that are safe and truly helpful for people with diabetes: avocado and olives. All other fruits are sugar traps that silently destroy your health. Why this topic is important? Most people think if it is natural, it must be healthy, but natural does not mean safe. One medium apple has about 20 grams of sugar, one banana up to 22 grams, and one handful of grapes, 16 to 18 grams. That is the same as drinking a glass of soda or eating a chocolate bar. The World Health Organization and the American Diabetes Association both emphasize in their guidelines that any source of simple sugars and fructose raises the risk of complications in people with diabetes. Unfortunately, many doctors still repeat outdated advice. According to the World Health Organization 2022, over 422 million people worldwide live with diabetes, and the majority of them have type 2 diabetes. Nearly 70% of patients report eating fruit daily, believing it to be safe. But data show that those who eat sweet fruits regularly are much more likely to have sharp spikes in glucose and faster progression of complications. Our first fruit, avocado. Many people are surprised. Avocado is fatty. Can it be healthy? Yes, precisely because of its composition, it is one of the safest fruits for diabetes. Nutritional content per 100 grams of avocado. Protein, 2 grams. Fat, 15 grams. Mostly monounsaturated omega-9 fats, protective for heart and vessels. Carbohydrates, 8.5 grams. Sugars, only 0.7 grams. Fiber, 6.7 grams. One medium avocado weighs about 200 grams and contains less than 1.5 grams of sugar. Compare this to an apple with 20 grams. The difference is 15 times. In a study published in Nutrients in 2020, which included 250 adults with metabolic syndrome, regular avocado consumption improved insulin sensitivity and lipid profiles. Conclusion for you: avocado does not raise blood sugar, it improves insulin response, protects the heart, and helps fight fatty liver. Our second fruit, olives. Olives are fruits too, although many people think of them only as snacks, but they are among the rare safe options for diabetes. Nutritional content per 100 grams of olives. Protein, 1 gram. Fat, 11 to 15 grams, mostly omega-9. Carbohydrates, 3.8 grams. Sugars, 0 grams. A serving of 10 olives contains less than 1 gram of carbohydrates. In a randomized study published in Diabetes Care in 2019, which included 400 patients with prediabetes, a diet enriched with olive oil and olives reduced the risk of progression to diabetes by 30% over 2 years. Conclusion for you: olives are sugar-free fruits that provide healthy fats, satiety, and vascular protection. Fourth layer, correcting deficiencies. Avocado and olives work best when deficiencies are corrected. Vitamin D. A meta-analysis in the Journal of Clinical Endocrinology and Metabolism, 2021, 2,500 participants with prediabetes, showed that supplementation reduced the risk of progression to diabetes by 30%. Magnesium. A study in Diabetes Care, 2017, 1,500 participants, found that magnesium supplementation lowered fasting glucose and improved HbA1c. Omega-3. Reviews in Nutrients, 2020, confirm omega-3 reduces inflammation and liver fat in insulin-resistant patients. Testosterone. In Endocrine Reviews, 2019, analysis of over 40 studies, low testosterone was shown to increase insulin resistance in both men and women, while replacement improved metabolic outcomes. Iron. Both deficiency and overload of iron worsen insulin sensitivity. Ferritin must be monitored. Conclusion. Friends, now you know the truth. Almost all fruits are sugar traps for people with diabetes. But there are two exceptions: avocado and olives. They contain almost no sugars, provide healthy fats and fiber, protect vessels and organs, and help stabilize blood sugar. If you include them in your diet, correct deficiencies, and follow a proper lifestyle plan, your blood sugar will remain stable, complications will decline, and the chance of remission will grow. And now my question for you: did you know before today that avocado and olives are the only truly safe fruits for diabetes? Write your answer in the comments, and we will continue this discussion in the next videos. Friends, every day I see people who honestly try to change their diet and walk more, but at the same time sincerely believe in simple life hacks from the internet. One of the most common myths is that lemon water supposedly lowers blood sugar, burns fat, and cures obesity. Because of such myths, precious time is lost while blood sugar remains high. I care about you, and that is why today we will calmly and scientifically discuss the topic of lemon water in type 2 diabetes and obesity. Where is the truth? Where is marketing? Which drinks are truly safe? Which ones provoke sugar spikes? And what to do in practice so that blood glucose levels are stable every day? Why this topic is relevant and why myths are dangerous. The myth of a magic drink with lemon is dangerous because it distracts from the real tools that work: strict carbohydrate control, daily walking, weight reduction, proper sleep. According to the World Health Organization, hundreds of millions of people live with diabetes and excess body weight, and sweet drinks, juices, lemonades, healthy drinks with syrups make a huge contribution to excess calories and glucose spikes. In the clinical recommendations of the American Diabetes Association, it is clearly stated the main drink in diabetes is water, unsweetened tea, and coffee without sugar. Lemon water is not considered a treatment, and all added sugars are strictly prohibited. Prevalence, where we most often make mistakes. Every day, millions of people replace plain water with healthy drinks, packaged juices, homemade lemonade, tea with honey, and sometimes they think that if they add lemon, the drink becomes healing. But in reality, this is the same sugar, which raises blood glucose and overloads the liver. Large health organizations emphasize liquid calories are the main hidden source of excess sugar for people with obesity and diabetes. No ritual with lemon water by itself lowers these values. They are improved by diet, walking, weight loss, and correct medications. Drinks can either not interfere or seriously harm. Our task is to learn to choose safe options. Symptoms and clinical picture: why drinks matter. If instead of water you regularly drink sweet drinks or lemon tea with honey, you will often experience sleepiness after eating, brain fog, thirst, frequent urination, and in the evening, hunger and sugar cravings. This is a typical cascade of postprandial hyperglycemia. Correct drink choices smooth out blood sugar spikes, improve well-being, and reduce the risk of overeating. Main part: step-by-step analysis of myths and solutions. Our first myth: lemon water lowers blood sugar by itself. Source and facts. In the clinical guidelines of the American Diabetes Association and in large reviews on nutrition and diabetes, there is no evidence that lemon water lowers blood glucose or hemoglobin A1C in people. Water is important as a replacement for sweet drinks, but lemon itself does not lower blood sugar. Numbers for the product. Lemon contains about 2 to 3 grams of sugar per 100 grams. One thin slice weighing 10-15 grams contains 0.2-0.3 grams of sugar. If you simply add a slice of lemon to a glass of water, there is practically no sugar, but also no medicinal effect. Takeaway for you: drink water in the amount recommended by your doctor and do not expect pharmacological effects from lemon. The benefit is in replacing juice or soda with lemon water, not in replacing plain water. Now, our second myth: homemade lemonade is healthy because it is homemade. Source and facts. In publications on obesity and diabetes prevention, experts repeatedly emphasize that homemade lemonade with sugar or syrups is the same sweet drink as store-bought. Numbers. Prepared lemonades and many homemade recipes contain about 9-10 grams of sugar per 100 milliliters. A normal glass of 250 milliliters contains 22 to 25 grams of sugar, which equals 5 to 6 teaspoons. Takeaway: if you dilute water with lemon juice without sugar, this is acceptable. If you add sugar or syrup, it becomes a sweet drink that spikes glucose. Our third myth: lemon with honey in the morning treats diabetes and obesity. Source and facts. In the recommendations of the American Diabetes Association, honey belongs to simple sugars and is not recommended for diabetes. Numbers. 1 tablespoon of honey contains about 17 grams of sugar, that is 4 teaspoons. Adding honey to warm water gives you a sweet drink, even if you add lemon. Takeaway: tea or water without sugar is safe. Lemon plus honey? No. Our fourth myth: lemon water burns fat and cures obesity. Source and facts. In clinical obesity reviews, there is no evidence that lemon juice by itself speeds up fat burning in people. Yes, replacing sweet drinks with water reduces daily calories and helps with weight loss. This is proven, but it is the effect of water, not lemon. Visual comparison. 1 glass of soda, about 140-160 kilocalories and 35-40 grams of sugar. 1 glass of water with a slice of lemon, 0.2 kilocalories and less than 0.5 grams of sugar. Takeaway: Drink water with a slice of lemon for aroma if you wish without sugar, but base weight loss on carbohydrate restriction, calorie deficit, and walking. Our fifth myth, lemon water works like vinegar and lowers post-meal spikes. Source and facts. In studies about vinegar, the effect comes from acetic acid, which slows gastric emptying and can reduce postprandial glucose spikes. Citric acid is a different acid. There are no data that lemon water has the same effect. Takeaway. Do not confuse vinegar and lemon. Lemon water at best is neutral, but it does not lower blood sugar. Our sixth myth. Vitamin C from lemon is necessary specifically from lemons. Source and facts. Nutrition reviews show that vitamin C can be safely obtained from low-carbohydrate vegetables, bell peppers, broccoli, leafy greens, without risking glucose spikes. Lemon is rich in vitamin C, but that does not make it a treatment for diabetes. Numbers. 100 grams of lemon contains about 2 to 3 grams of sugar. Eating half a lemon is already 1 to 1.5 grams of sugar. For aroma, it is safer to add just a slice into water, while vitamin C is best obtained from vegetables. Our seventh question. Is lemon water allowed at all? Source and facts. In diabetes guidelines, lemon water is not considered a treatment, but water without sugar is the standard. Adding a slice of lemon for aroma, without squeezing juice and without sugar, is acceptable. Numbers. A lemon slice, 10-15 grams, contains about 0.2-0.3 grams of sugar, essentially zero. The problem starts when you add honey, sugar, syrups, or make delicious lemonade. Safe drinks. What to choose in practice. Plain water, the basic drink. Water intake is individualized with your doctor, considering heart and kidneys. Mineral water without sugar, allowed. Tea and coffee, only without sugar and syrups. Milk and cream can raise glucose and should be considered. Flavored water without sugar, acceptable. A slice of lemon. A mint leaf without squeezing and without sweeteners. Juices, lemonades, detox waters with honey. Agave syrup, date syrup, prohibited. Practical daily plan. Drinks, water, unsweetened tea, unsweetened coffee. Optionally, water with 1 slice of lemon, no squeezing and no sugar. Food, carbohydrate budget 15 to 30 grams per meal, depending on the person, every meal. Protein, plus non-starchy vegetables, plus healthy fats. Walking, 60 minutes per day, can be 2 to 30 minutes, especially after meals, so muscles take up glucose from blood. Sleep, 7 to 8 hours. Lack of sleep worsens insulin sensitivity. Monitoring. Check glucose before and 2 hours after meals. Write numbers in a notebook. Remove foods and drinks that spike. Absolutely no lemon with honey, no sweeteners, no syrups. These always cause sugar spikes. Ending with a guarantee of results. Friends, if you stop drinking sweet drinks, switch to plain water. Optionally with a slice of lemon without sugar. And at the same time, start following a carbohydrate budget and daily walking. Your blood sugar will stabilize within the next week, sugar cravings will decrease, and in a few months you will lose weight and reduce complications risk. I guarantee with this approach, diabetes can be controlled, and at the stage of prediabetes, remission is possible. And now my question for you. What drinks do you usually consume during the day, and do any of them include sweet ones? Write in the comments, and in the next video, we will analyze your examples and create a safe drink plan for the week. Sources used: World Health Organization, American Diabetes Association, Cleveland Clinic, Mayo Clinic, Harvard Health, Diabetes Care, The Lancet, BMJ, Endocrine Reviews. They all agree on one thing. Water without sugar, yes. Drinks with sugar, including homemade lemonades. No, lemon water is simply flavored water, not a treatment for diabetes. Friends, I see every day how people with diabetes make the same mistake. They think that lunch is a light snack and therefore safe. But in reality, it is in the middle of the day when blood sugar often rises so high that it becomes almost impossible to stabilize it until the evening. I sincerely care about you, and that is why I made this video. Today we will review the 10 most dangerous and harmful lunches for people with diabetes. You will learn what exactly raises blood sugar, how to replace these foods, and how to make your lunch work for your health and not against it. According to the World Health Organization 2022, more than 420 million people in the world live with diabetes, and poor nutrition is the main factor for complications. The American Diabetes Association, ADA, clearly states refined carbohydrates and hidden sugars in snacks accelerate the progression of the disease. Our first lunch, sweet snack bars, they look like energy in your pocket, but in reality, they are a sugar bomb. In 100 grams of a bar, about 55 to 60 grams of carbohydrates, of which 30 to 35 grams are sugar. In a study published in BMJ Nutrition in 2021, with more than 800 adults with diabetes, it was shown. Regular consumption of sweet bars increases HbA1c by 0.7% in just 3 months. Conclusion: such snacks are a direct path to diabetes decompensation. Alternative: a handful of nuts, 20-30 grams, or sugar-free cheese snacks. Our second lunch: white bread with sausage. A familiar snack: a slice of white bread and sausage. But here are two enemies: refined starch and hidden sugars in processed meat. In 100 grams of white bread, 50 grams of carbohydrates, almost all fast digesting. According to Harvard Health 2020, one slice of white bread acts on blood sugar almost the same way as a tablespoon of sugar. Sausage often contains dextrose, starch, and salts that worsen insulin resistance. Danger: spikes in glucose and strain on blood vessels. Replacement: low-carb whole grain bread and boiled chicken breast or fish. Our third lunch: fruit yogurt. You may think that fruit yogurt is a healthy snack. In reality, in 150-gram cup, there are about 18 to 20 grams of sugar. In a study published in the Lancet Diabetes and Endocrinology in 2019, including 4,500 patients with diabetes, it was shown that sweetened dairy products increase the risk of cardiovascular complications by 18%. Danger: it is a dessert, not health. Replacement: plain Greek yogurt without sugar plus nuts or seeds. Our fourth lunch: fruit smoothies. Store-bought smoothies look healthy, but in reality, they contain from 25 to 40 grams of sugar per bottle. There is almost no fiber, and absorption is instant. The American Diabetes Association 2022 classifies fruit drinks as foods that should be maximally limited. Danger: sugar load equal to soda. Replacement: protein shakes without sugar, water with lemon, green tea. Our fifth lunch: instant noodles. One package, 75 to 90 grams, contains more than 50-55 grams of carbohydrates. Almost all of it is fast-digesting starch. In addition, salt and trans fats worsen insulin resistance. According to Cleveland Clinic Journal of Medicine, 2021, regular consumption of instant noodles is associated with a 68% higher risk of metabolic syndrome. Danger: rapid increase in blood sugar and blood pressure. Replacement: vegetable stew or broccoli cream soup with chicken. Our sixth lunch: French fries in 100 grams, 35 grams of carbohydrates, and 17 grams of fat. One medium serving, 150 grams, 50 grams of carbohydrates, and 25 grams of fat. In a study published in Diabetes Care 2020, with more than 4,000 patients, it was shown regular consumption of fried potatoes increases the risk of cardiovascular events by 19%. Danger: double hit, fast carbs, and harmful fats. Replacement: baked vegetables or zucchini chips without oil. Our seventh lunch: pizza. One slice of pizza weighing 120 grams, worth about 30 grams of carbohydrates and 12 grams of fat. In one standard serving, up to 3 to 4 slices. According to Journal of the American College of Cardiology 2022, processed meat and white flour in pizza are associated with accelerated progression of diabetes. Danger: hidden sugar, salt, saturated fats. Replacement: keto pizza on almond flour or vegetable casserole. Our eighth lunch: sweet pastries, croissants, buns, muffins. In one pastry, 50-60 grams of carbohydrates, half of them sugar. The World Health Organization 2021 states, pastries and confectionery are one of the main sources of added sugar worldwide. Danger: sugar spikes and weight gain. Replacement: sugar-free cottage cheese or omelette. Our ninth lunch: energy drinks. One can, 250 milliliters, sour 27 to 30 grams of sugar, 120 kilocalories, and 80 milligrams of caffeine. A large can, 500 milliliters, saccharin double dose. In a review published in Nutrients 2020, it was stated, regular consumption of energy drinks increases the risk of arrhythmias and worsens glucose control. Danger: sugar plus nervous system overstimulation. Replacement: green tea, mineral water. Our 10th lunch: sushi with white rice, one standard portion, 6 to 8 rolls, side of 50-60 grams of carbohydrates. White rice is fast starch, often with added sugar for flavor. According to Mayo Clinic 2020, white rice increases the risk of type 2 diabetes by 11% with regular consumption. Danger: instant glucose spike after eating. Replacement: cucumber and salmon rolls without rice, fish salads. Fourth layer: correcting deficiencies. We must remember, not only food matters, but also correcting deficiencies. Vitamin D, Diabetes Care 2021, 2,500 participants, reduces the risk of prediabetes progression to diabetes by 30%. Magnesium, Diabetes Care 2019 meta-analysis improves glucose control. Omega-3 nutrients 2020 reduces inflammation and fat in the liver. Testosterone, Endocrine Reviews 2021 reduces insulin resistance. Iron, both deficiency and overload worsen insulin sensitivity. Conclusion. Friends, now you know which lunches are the most dangerous for people with diabetes. But the most important thing, you know how to replace them. Guarantee of result: if you eat properly and correct deficiencies, your sugar will become stable and the risk of complications will decrease. You will protect your heart, kidneys, and eyes. Question for you. What snacks do you most often encounter in your life? Write in the comments and I will analyze them in the next videos. Friends, we have reached the final 6 nighttime symptoms of diabetes. These are signs that are especially often overlooked. People blame them on the heart acting up, overeating, nerves, or just stress. But in reality, they are serious indicators that glucose is interfering with the work of your heart, brain, breathing, and sleep. I want you to know these symptoms clearly and be able to protect yourself in time. Symptom 13, nighttime tachycardia and hot flashes. Why it occurs: when glucose levels fluctuate sharply, the autonomic nervous system is activated. The heart starts beating faster with sensations of palpitations or hot flashes. Statistics: American Diabetes Association 2021. Up to 15 to 20% of diabetics regularly report nighttime tachycardia. Danger: nighttime arrhythmias increase the risk of stroke and sudden death during sleep. How to distinguish? In panic attacks, tachycardia is usually combined with anxiety. With diabetes, it occurs without obvious reason during the night, often with elevated glucose. What to do? Measure glucose when tachycardia occurs. Avoid sweet, carbohydrate-heavy dinners. Discuss an ECG and heart evaluation with your doctor. Symptom 14, frequent nighttime urination in men. Why it occurs? In diabetes, the bladder fills more quickly due to osmotic diuresis. In men over 50, prostate enlargement may also play a role. Statistics: Mayo Clinic 2019, 30% of men with diabetes complain of frequent nighttime urination. Danger: combination of hyperglycemia and prostate enlargement increases risk of urinary tract infections. How to distinguish? With prostate issues, urination is frequent both day and night. With diabetes, mainly nighttime, combined with thirst and dry mouth. What to do? Check glucose. See a urologist if needed. Avoid evening alcohol and sweet drinks. Symptom 15, snoring and sleep apnea. Why it occurs? Excess weight and diabetes increase obstruction of the upper airways. A person may stop breathing for 10 to 30 seconds, the brain briefly awakens, and loud snoring occurs. Statistics: BMJ 2018, 40% of men with obesity and diabetes have sleep apnea. Danger: risk of heart attack and stroke increases 2 to 3 times. Sleep becomes fragmented, glucose is harder to control. How to distinguish? If your partner notices pauses in breathing with loud snoring, this is sleep apnea. With simple snoring, there are no breathing pauses. What to do? Weight loss, sleep study, polysomnography, CPAP therapy if prescribed by a doctor. Symptom 16, nighttime heartburn and reflux. Why it occurs? Late dinners with carbohydrates and fatty foods provoke acid reflux. In diabetes, gastrointestinal motility is often impaired, worsening the reflux. Statistics: Harvard Health 2019, 20-25% of diabetics report nighttime heartburn. Danger: chronic reflux damages the esophagus and increases the risk of esophageal cancer. How to distinguish? Occasional heartburn after overeating is rare. In diabetes, it happens repeatedly, especially at night. What to do? Finish dinner 3 to 4 hours before bed. Avoid sweets. Sleep with head slightly elevated. See a gastroenterologist if frequent. Symptom 17, restless legs syndrome. Why it occurs? Diabetic neuropathy and glucose fluctuations irritate nerves. A person feels twitching, tingling, or an urge to move the legs, especially before sleep. Statistics: Mayo Clinic 2017, 25% of diabetics have restless leg syndrome. Danger: chronic sleep deprivation, worsening fatigue, reduced quality of life. How to distinguish? With stress, leg twitching may occur during the day. In diabetes, mainly at night, interfering with sleep. What to do? Check glucose. Avoid caffeine and alcohol in the evening. Do light stretching exercises for the legs before bedtime. Symptom 18, nightmares. Why it occurs? Nocturnal drops in glucose, hypoglycemia, trigger brain activity and vivid, frightening dreams. Statistics: Cleveland Clinic 2020. 15% of patients on insulin report frequent nightmares linked to hypoglycemia. Danger: hidden nighttime hypoglycemia can go unnoticed and increases the risk of coma. How to distinguish? If nightmares occur several times a week and are accompanied by sweating, trembling, or morning weakness, glucose is the likely cause. What to do? Measure glucose around 3 a.m. Discuss insulin doses with your doctor. Avoid late fast carbohydrate snacks. Conclusion of the trilogy. We have now covered all 18 nighttime symptoms of diabetes, from frequent bathroom trips and thirst to neuropathy, restless legs, reflux, and nightmares. If you notice at least 3 or 4 of these signs, this is a serious reason to check your glucose and HbA1c. I guarantee if you pay attention to nighttime signals, adjust your diet, and consult your doctor in time, your sleep will become deeper and your glucose levels more stable within the next weeks. Now my question to you: which of these symptoms do you most often notice? Tachycardia, heartburn, snoring, or nightmares? Friends, today we continue our discussion of the signals your body gives at night. These symptoms are often written off as nerves, allergies, or just age, but the truth is that many of them are directly linked to diabetes and high glucose levels. I want you to recognize these clues from your body and not ignore them. Symptom 7. Burning and numbness of the feet, diabetic neuropathy. Why it occurs? With chronic hyperglycemia, glucose damages small nerves, especially in the feet. As a result, burning, tingling, or pins and needles sensations appear at night. Statistics: The Lancet Diabetes and Endocrinology, 2019. Up to 50% of patients with diabetes longer than 10 years suffer from neuropathy. Danger: if left untreated, this leads to diabetic foot syndrome, ulcers, and even risk of amputation. How to distinguish? In osteochondrosis or spine issues, pain is stronger during the day and depends on posture. In diabetes, the discomfort is worse at night, even when resting. What to do? Keep glucose within target levels. Inspect feet daily for skin changes. Discuss nerve protective therapies with your doctor. Alpha lipoic acid, B vitamins. Symptom 8. Itchy skin, especially in the intimate area. Why it occurs? High glucose creates a favorable environment for fungi and bacteria. This problem is particularly common in women. Statistics: BMJ 2018. About 30% of patients with poorly controlled diabetes report recurrent nighttime itching. Danger: fungal infections, urinary tract infections, chronic inflammation. How to distinguish? Allergies usually cause itching with a rash. With diabetes, itching occurs regularly without rash and worsens at night. What to do? Stabilize glucose. Wear cotton underwear. Treat infections as prescribed by your doctor. Symptom 9. Morning headaches. Why it occurs? They can result from nocturnal hypoglycemia, especially in patients on insulin, or the dawn phenomenon, when stress hormones raise glucose at 5 to 7 a.m. Statistics: Cleveland Clinic 2020. About 25% of diabetics regularly wake up with headaches. Danger: such episodes increase stroke risk and impair cognitive function. How to distinguish? Migraines may occur any time of day. With diabetes, the headaches appear mainly in the morning and often improve after breakfast. What to do? Check glucose before bedtime, at 3 a.m., and in the morning. Discuss medication timing and doses with your doctor. Avoid late carbohydrate-heavy dinners. Symptom 10. Fog in the head in the morning. Why it occurs? Glucose fluctuations during the night disturb brain function. A person wakes up with the feeling of not having slept at all. Statistics: Harvard Health 2020. 30-35% of patients with diabetes report morning weakness and cognitive clouding. Danger: reduced attention, increased risk of accidents, accelerated brain aging. How to distinguish? With simple sleep deprivation, fatigue persists all day. With diabetes, the fog is strongest in the morning and may improve after eating. What to do? Have a light dinner without sweets. Add 20-30 minutes of evening walking. Monitor glucose in the evening and morning. Symptom 11. Dry, cracked lips and tongue. Why it occurs? In hyperglycemia, the kidneys remove excess glucose along with water, leading to dehydration and dryness of mucous membranes. Statistics: American Diabetes Association 2019. 40% of patients with high nighttime and morning glucose show dry lips and tongue. Danger: risk of dental infections, gum inflammation, bad breath. How to distinguish? In winter, dryness is common for everyone. With diabetes, dryness persists even in warm seasons and is present at night and in the morning. What to do? Drink water evenly throughout the day, not in large amounts at night. Avoid sweet beverages. Control glucose levels. Symptom 12. Nighttime joint stiffness and thirst. Why it occurs? In diabetes, dehydration aggravates joint inflammation. Glucose damages collagen, making ligaments and joints less flexible. Statistics. Mayo Clinic, 2018. About 20% of patients with diabetes complain of nighttime or morning joint stiffness. Danger: development of diabetic arthropathy, contractures, reduced mobility. How to distinguish? In arthritis, stiffness improves during the day with movement. In diabetes, stiffness is worse at night and in the morning, often combined with thirst and dryness. What to do? Control glucose. Maintain a healthy weight. Add gentle joint exercises such as stretching or yoga. Conclusion. Friends, we have discussed the next 6 nighttime symptoms: neuropathy, nighttime itching, morning headaches, brain fog, dry lips, and joint stiffness. These signals must not be ignored. They mean high glucose is damaging your nerves, vessels, and joints. I guarantee if you stabilize glucose, correct your dinner, and add light evening activity, you will feel relief and improve sleep within a few weeks. Now my question to you, which of these symptoms have you noticed most often? Burning feet, headaches, or dry lips? Every single morning, millions of people around the world make the same mistake. They pour a glass of orange juice, prepare a packet of instant oatmeal, or toast white bread. They believe they are starting the day in a healthy way, but the truth is, these breakfasts overload the liver, damage the blood vessels, and accelerate the complications of diabetes. According to the World Health Organization, more than 422 million people worldwide live with diabetes. Breakfast is the meal most often responsible for uncontrolled glucose. I am an endocrinologist, and every year more than 1,000 of my patients achieve remission of type 2 diabetes. Today I will show you 10 breakfasts that silently destroy blood sugar and the alternatives that will keep it stable. Breakfast number 1. Instant oatmeal. A sugar bomb instead of health. One portion of instant oatmeal, 40 grams, contains about 27 grams of carbohydrates, equal to 5 teaspoons of sugar. What happens? Your blood sugar rises sharply, insulin is released, and within 1 hour you feel both sleepy and hungry again. In the American Journal of Clinical Nutrition in 2019, researchers published a study showing that processed cereals raise blood sugar 40 to 60% more than whole oats. And in the Long-Term Nurses Health Study 2, PubMed ID 15531689, which followed tens of thousands of women, the scientists found that those who ate sweet cereals regularly had a 32% higher risk of type 2 diabetes compared to women who chose whole grains. Alternative: whole oats cooked in water with flax or chia seeds and walnuts. The same porridge, but without the sugar roller coaster. Breakfast number 2. Orange juice, liquid sugar instead of vitamins. One glass, 250 milliliters, contains 25 grams of sugar, equal to 2 pastries or 1 can of soda. What happens? Fructose goes straight to the liver, where it is converted into fat, raising triglycerides and the risk of fatty liver disease. In the Journal of Clinical Endocrinology and Metabolism in 2021, a study showed that regular fructose intake was linked with higher risk of cardiovascular disease, and a meta-analysis published in BMJ in 2014, PubMed ID 24493-081, found that people who drank fruit juice regularly had a 21% higher risk of developing type 2 diabetes. Alternative: water with lemon or unsweetened green tea. Breakfast number 3. White bread and toast, disguised soda. 2 toasts, 60 grams, contain about 30 grams of carbohydrates, equal to 7 teaspoons of sugar after digestion. What happens? Starch is broken down into glucose within minutes, blood sugar surges, and blood vessels in the eyes and kidneys are damaged. In the New England Journal of Medicine in 2020, researchers reported that daily white bread consumption raised the risk of type 2 diabetes by 37%. The EPIC cohort study, PubMed ID 12885743, also confirmed people who ate the most white bread had a 38% higher risk of type 2 diabetes than those who ate the least. Alternative: flaxseed crisp bread or low-carbohydrate bread with psyllium. Breakfast number 4. Sweet yogurt, dessert disguised as health 1 cup, 150 grams, contains about 27 grams of sugar, equal to 5.5 teaspoons. What happens? Blood glucose and insulin surge, and fat accumulates in the abdominal area. In Cochrane Review 2018, scientists concluded that sweet dairy products increase the risk of metabolic syndrome. And in Diabetes Care in 2014, PubMed ID 244465 tell, with data from more than 190,000 adults, frequent consumption of sweetened dairy products was linked to a 22% higher risk of type 2 diabetes, while plain yogurt lowered the risk. Alternative: plain Greek yogurt with chia seeds. Breakfast number 5. Pancakes. A sweet trap on your plate. 2 pancakes, 150 grams, contain 52 grams of carbohydrates, equal to a can of soda or 10 teaspoons of sugar. What happens? Chronic spikes in glucose damage the endothelium, accelerate atherosclerosis, and raise the risk of heart attack. In Circulation 2021, PubMed ID 338519909, researchers showed that regular intake of refined flour was linked to a 28% higher cardiovascular mortality. And in the ERIC study, PubMed ID 267746178, which followed over 13,000 people, those who consumed the most refined flour products had a 27% higher risk of heart attacks and strokes. Alternative: cottage cheese pancakes or egg and psyllium fritters, same form, but 5 times fewer carbohydrates. Breakfast number 6, fruit smoothies, a sweet trap in a glass. A smoothie, 300 milliliters, contains about 45 grams of sugar with almost no fiber. What happens? Liquid sugar is absorbed faster than solid food, and glucose levels rise even higher. In Diabetes Care in 2020, PubMed ID 320799657, it was demonstrated that liquid calories cause stronger sugar spikes than whole fruit. And in the Framingham Offspring study, PubMed ID 28982792, those who drank fruit smoothies and juices had a 35% higher risk of diabetes compared to those who ate whole fruit. Alternative: spinach and avocado smoothie with unsweetened almond milk. Breakfast number 7, bagels and croissants, a fast track to atherosclerosis. 1 bagel, 120 grams, contains 60 grams of carbohydrates and about 12 grams of fat, often with trans fats. What happens? The sugar spike combined with trans fats fuels inflammation and speeds up atherosclerosis. In JAMA Internal Medicine in 2019, PubMed ID 314799142, researchers showed that regular pastry consumption increased the risk of chronic kidney disease by 18%. And in the Nurses' Health Study, PubMed ID 2371765, women who frequently consumed pastries had a 25% higher risk of cardiovascular disease. Alternative: whole grain sourdough bread or crisp bread with avocado. Breakfast number 8, rice porridge, a sweet mask. 1 bowl, 250 grams, contains 70 grams of carbohydrates, equal to 14 teaspoons of sugar. What happens? Blood sugar rises quickly, and brain and kidney vessels are overloaded. In BMJ in 2019, PubMed ID 3287192, daily consumption of white rice was linked to a 55% higher risk of type 2 diabetes. A meta-analysis in BMJ 2012, PubMed ID 222422870, compared Asia and Western countries. In China and Japan, the risk rose by 55%, while in the West, it rose by 12%. Alternative: buckwheat cooked in water with flax seeds and a boiled egg. Breakfast number 9. Donuts and pastries. A sugar bomb with filling 1 donut, 80 grams, contains about 40 grams of sugar plus trans fats. What happens? Weight gain, systemic inflammation, and progression of diabetes. In the Lancet Diabetes and Endocrinology in 2021, PubMed ID 344425889, researchers found that ultra-processed foods increase the risk of cardiovascular mortality by 31%. And in the French Nutrinet Santé cohort, PubMed ID 3067065, with more than 100,000 participants, those who ate the most ultra-processed foods had a 23% higher risk of type 2 diabetes. Alternative: a handful of nuts or seeds. Breakfast. Number 10. Mashed potatoes, fast digesting starch instead of energy. 1 portion, 200 grams, contains about 40 grams of starch, equal to 10 teaspoons of glucose after digestion. What happens? Blood sugar rises sharply, insulin spikes, kidneys are overloaded, and microvascular complications accelerate. In Harvard School of Public Health 2018, PubMed ID 299987030, daily potato consumption was linked to a 33% higher risk of type 2 diabetes. And in another analysis from the Nurses' Health Study, PubMed ID 21730329, women who ate potatoes frequently had a 20 to 33% higher risk of diabetes, depending on frequency. Alternative: zucchini fritters with psyllium, same texture as potatoes, but almost no sugar load. Final message: movement as medicine. Even if you replace all of these breakfasts with healthier ones, your sugar will not stay stable without movement. The patients who achieve remission all do one simple thing: cardio exercise for 60 minutes twice a day, morning and evening, walking or cycling. This routine improves insulin sensitivity, reduces weight, and protects the heart. Conclusion: a glass of juice equals a strike to the liver, a toast equals a step toward retinopathy, a donut equals a shortcut to a heart attack. But if you replace these breakfasts with healthy alternatives and add daily movement, within weeks, your sugar stabilizes, your blood pressure improves, and your energy returns. This is the true path to remission of type 2 diabetes and to preventing its complications. Friends, I want to share what I see every day. People complain, "Doctor, I get up 3-4 times a night to go to the bathroom. I wake up thirsty. I sweat so much at night the sheets are wet. My legs cramp at night." Most people think it is just age, stress, prostate issues, but very often these are the first signals of diabetes. I care about you because ignoring these signs means losing the chance to take control of the disease at the stage when it is still possible to reverse it. Today we will look at the first 6 most common nighttime symptoms of hidden or overt diabetes. Symptom 1: frequent urination at night, nocturia. Why it occurs: when blood glucose exceeds 10 mol/Al, 180 mg/dL, the kidneys cannot cope. They try to remove excess glucose through urine. Sugar pulls water with it, so a person is forced to wake up 3 to 5 times a night. Statistics: Diabetes Care, 2017, study of 2,200 patients with type 2 diabetes. Up to 65% reported nocturia. Danger: constant nighttime awakenings disturb sleep, led to dehydration, and in the long run damage the kidneys, diabetic nephropathy. How to distinguish: with prostate problems in men, urination is weak, frequent both day and night. With diabetes, the stream is normal, but awakenings are mainly at night. What to do: check blood glucose before bedtime and in the morning. Avoid sweet drinks in the evening. If you wake up 3 or more times a night, this is a reason to have your glucose and HbA1c checked. Symptom 2: nighttime thirst and dry mouth. Why it occurs: together with urine, large volumes of fluid are lost. The body may lose 1 to 2 liters overnight. To compensate, the brain creates a strong feeling of thirst. Statistics: Mayo Clinic, 2019. Up to 50% of patients with uncontrolled diabetes experience nighttime thirst. Danger: chronic dehydration thickens the blood, increasing the risk of thrombosis, stroke, and heart complications. How to distinguish: if the cause is heat or dry air, thirst is present also during the day. If it is diabetes, thirst appears mainly at night in normal conditions. What to do? Drink only water, not juice or sweet tea. Always check glucose when you feel discuss treatment correction with your doctor. Symptom 3: night sweats. Why it occurs: 2 mechanisms: hyperglycemia, blood vessels, and the heart work under overload. Hypoglycemia: a sudden drop in glucose in those on insulin or tablets. Statistics: American Diabetes Association, 2020. Up to 30% of patients on insulin experience nocturnal hypoglycemia, often with sweating. Danger: sleep deprivation, risk of nighttime falls, and in hypoglycemia, even coma. How to distinguish: if sweating occurs without fever, especially at 2-3 a.m., check your glucose. What to do: keep a glucose diary, evening 3 a.m., morning. Discuss medication doses with your doctor. Build dinner around protein and vegetables, avoiding fast carbohydrates. Symptom 4: night hunger and tremors. Why it occurs: evening spikes in glucose lead to drops at night. The brain responds with strong hunger, tremors, anxiety. Statistics: BMJ, 2018. 20 to 25% of patients on therapy experience such episodes at least once a month. Danger: nighttime snacks with sweets lead to high morning glucose, creating a vicious circle. How to distinguish: if you wake up hungry with tremors and cold sweat, this is not habit, it is a signal of glucose fluctuations. What to do: dinner, protein, plus non-starchy vegetables, plus healthy fats. Exclude late sweets and fruits. Always measure glucose during such episodes. Symptom 5: insomnia and frequent awakenings. Why it occurs: in hyperglycemia, the brain and body remain in a stress mode. In hypoglycemia, stress hormones, adrenaline, cortisol, are activated. Statistics: Harvard Health, 2019. Up to 40% of diabetics have sleep disorders. Danger: sleep deprivation increases insulin resistance by 20-30%, intensifies cravings for sweets during the day. How to distinguish: If you wake up without reason at the same time and feel weak in the morning, glucose may be the cause. What to do? Sleep 7 to 8 hours. Go to bed on schedule. Light dinner, no sweets. Check glucose in the evening and morning. Symptom 6, night cramps in the legs. Why it occurs: dehydration and loss of electrolytes, potassium, magnesium due to hyperglycemia. Statistics, BMJ 2019, 35 to 40% of diabetics report regular cramps. Danger, risk of falls at night, chronic pain, progression of sarcopenia. How to distinguish if cramps occur mainly at night and glucose is unstable, the cause is likely diabetic. What to do? Have blood tests for electrolytes and replenish deficiencies. Keep glucose under control. Okay? Do light stretching for the legs before bedtime. Conclusion. We have discussed the first 6 nighttime symptoms of diabetes. If you notice at least 2 or 3 of them, do not postpone glucose testing. I guarantee, if you remove late sweets, make dinner balanced, drink only water, and add glucose control, your sleep will become calmer and glucose levels more stable in just 1 to 2 weeks. Now my question to you, which of these symptoms do you most often notice at night? Many people believe they make the right choice at breakfast, but research shows the most common foods can accelerate the development of diabetes. Today, I will tell you about 10 breakfasts that may look safe, but in reality, they raise blood sugar as strongly as dessert. Breakfast number 1, cornflakes, a sweet deception. In BMJ 2016, researchers published findings showing that regular consumption of cornflakes increased the risk of diabetes by 22% in adults. One portion, 40 grams, contains 35 grams of carbohydrates, of which 12 grams are sugar, equal to 7 teaspoons of sugar. In the Nurses' Health Study cohort, women who frequently consumed breakfast cereals had a 24% higher risk of type 2 diabetes. Alternative, unsweetened granola made of oat bran, seeds, and nuts. Breakfast number 2, bagel with cheese, a carbohydrate trap. One bagel, 120 grams, contains about 65 grams of carbohydrates. Cheese only slightly softens the blow. In JAMA 2019, it was shown that regular consumption of refined white flour products increased the risk of obesity and diabetes. In the Framingham Heart Study, men who ate white bread and bagels daily had a 30% higher risk of diabetes. Alternative, whole grain flatbread with avocado. Breakfast number 3, fried potatoes, fast sugar and fat. One portion, 150 grams, contains 45 grams of starch and 15 grams of fat. In the American Journal of Clinical Nutrition 2016, researchers found that frequent consumption of fried potatoes was associated with a 33% higher risk of diabetes. Alternative, baked